I'm Dr. Alexandra Sanchez, and I'm an electrophysiologist here at Holy Cross Health. Here to talk to you a little about sudden cardiac arrest. Every year, more than 350,000 people die from sudden cardiac arrest, and that includes over 20,000 kids and even teenagers. That's why Congress has paired up with several health organizations such as the Heart Rhythm Society in order to make October Sudden Cardiac Awareness Month, and that's in hopes of educating those that are at highest risk for sudden cardiac arrest, raising awareness, and hopefully saving lives. Now, people confuse sudden cardiac arrest with heart attacks, and it's important to understand the difference. So a heart attack is more of a plumbing issue when there's blockages in your arteries and there's not enough blood flow that gets to your heart. Sudden cardiac arrest, on the other hand, is more of an electrical or structural problem where your heart just stops beating suddenly. So it's important to understand the difference and to know what the risks are involved in sudden cardiac arrest. So things that can predispose you are prior heart attacks, heart failure, so it's important that you know what your ejection fraction is, cardiomyopathies, certain congenital or genetic abnormalities, and even severe valvular diseases can predispose somebody to sudden cardiac arrest. So some patients might feel fluttering, some warning signs, but most of the time it just happens all of a sudden with no warning signs. Starting CPR at first is the most important thing. In the meantime, calling for help and having somebody find an AED nearby would be the next steps. Now, as an electrophysiologist, I'm the electrician of the heart. I deal with the electrical system. So I manage these dangerous arrhythmias that can lead to sudden cardiac death. So, if we identify that you're one of these patients that are at high risk, we talk about lifestyle changes that can minimize your risk for sudden cardiac death. We can do procedures such as ablations. And if you meet the indication or you qualify for a defibrillator, we go ahead and implant those as well in order to work on preventing sudden cardiac death and saving your life. A defibrillator is a device that we place inside the heart. It's able to detect in real time if you're having one of these dangerous rhythms before you even pass out. That's the hope. So there's different algorithms built into the device that sometimes it tries to just pace you out of the dangerous rhythm before it delivers a shock. But if your heart rate is going too fast, too dangerously fast, where you potentially can lose consciousness, then it'll shock you back into your normal rhythm and save your life. Any of our patients that have devices in place, we do remote checks. So usually every 3 months we're getting transmissions from your home, but we have you come in regularly as well. During those remote checks, we can see if you've had any events. However, if you do end up getting shocked by your device, we get alerted that that happened. And we'll see why that happened, if you received an appropriate shock or an inappropriate shock. If there's any medications that we can optimize to prevent further shocks from happening, we'll go ahead and do that. For any adjustments to the device that we need to do, we would do that as well. So the hope is not for you to get shocked, but if you do get shocked, you know that for the most part, if it was an appropriate shock, it saved your life. We have a great team here at Holy Cross of cardiologists. We have our general cardiologist, we have our interventional cardiologist, and of course you have your electrical cardiologist as well. And we all work together in order to identify those patients that are highest risk for sudden cardiac death. And so, we're in constant communication where if somebody is able to identify one of these patients, they immediately refer them to us so that we can evaluate if they are in fact a candidate for a defibrillator and get them set up for a procedure.